pack you every day, giving you more information than anybody else, making you prepared for the day so you can go out there and talk with authority because you have the information to address people on all sorts of topics. Charles Sauer is an author, economist, and president of the Market Institute. He's joining me now. Charles, thank you for being here.
Having me on.
Great to have you. Look, the government shutdown, what are we, day 16? I lose track. It doesn't really impact me much. I don't have a government job. Obviously, I'm surviving out here in the wilderness. But the big argument is over health care. And
Yep.
Speaker Mike Johnson says, look, we don't have anything to negotiate here. We've got until the end of the year. And if I'm not mistaken, the Republicans already offered a one-year extension on these subsidies to find a way and a path forward. But you say there are other ways for conservatives to win on health care. What are your thoughts?
Yeah, I mean, there are so many options that they don't seem to be looking at. We have the idea that we can actually we've talked about this before actually, but there's site neutral payments is a huge option that we could do. And that's the fact that the government is currently paying hospitals more than independent physicians for the same services. And this has caused what we've all seen in all of our communities, and that's that hospitals are growing and buying independent offices. And so these large hospital systems are kind of taking over the country. We can also move it where we can have our primary care physicians prescribing and dispensing our medicines, which cuts out a wide swath of middlemen. And to do most of this, the government doesn't really even have to do anything. All they have to do is expand HSAs. If they can expand HSAs, we get more money in the patient's pocket that we can spend on healthcare. And as soon as patients can spend more money on healthcare, then the competition for those dollars can start. Right now, patients aren't the primary payer. Right now, The employers are the payer, the government is the payer, and the insurance companies are the payer. We need to put the patient back in the driver's seat.
We do need to do that. And look, government meddling, I think is a fair way to put it. Government meddling, Charles, has created this situation. The Democrats are out there right now. Well, all these hospitals are going to go bankrupt. Those hospitals were on the verge of bankruptcy anyway because of bad government policies and CMS reimbursement rates. That's a fact. CMS is what reimburses hospitals. It used to be 30 years ago, it was pretty straightforward. There was a reimbursement rate that was reasonable, and you would get it back within a few days or a couple of weeks. Now hospitals have entire departments where they fight with the government to get reimbursed at rates that keep them at a bankrupt level. It's true. I did an entire documentary on hospitals in this country in 2023 at the end of the year. And this idea that somehow the Republicans are responsible for hospitals going bankrupt is absolutely absurd, isn't it?
Well, so I think, and actually I've got that tutu behind me right now, and it's a part of a video that shows that I disagree with you. And the fact is that hospitals are charging prices like they're a boutique. And in fact, hospitals are Walmarts. If you go into an independent doctor's office, they have this individual brick and mortar. Everything costs more for them. Every Band-Aid costs more. That front desk costs more. That nurse costs more. Everything costs more for an independent physician than a hospital. And so I do think hospitals should be getting paid less. It's not like you go into Walmart and expect to pay higher prices.
Hold on, Charles. Hold on, because here's the deal. In places like Ducktown, Tennessee, they were required to take $15 for anybody that walked in the emergency room. That was it. That was the reimbursement rate, $15. You couldn't pay a nurse for 15 minutes for that kind of reimbursement, and they're required to take them. Then you've got big, giant healthcare conglomerates that'll go in and buy 4 or 5 hospitals and close 3 of them and say, well, people will go to the other 2. So there's profit-driven motives, there's government-driven motives, and then there's the insurance industry, which, according to one of the people I talked to, is dirtier than the Russian, intelligence community. There's a lot of things going on here, right or wrong.
So you're right in the fact that there's a lot going on. And I would say that the hospitals and the insurance companies have long been in collusion with each other. When you look at the way that prices are decided and discussed, hospitals can put whatever they want to price something at, and then the insurance companies get to brag that they get you a discount, but it's a discount from a make-believe price. And so there's this collusion that goes on where we just end up with higher prices for the people that don't have insurance or for the
Well, that's
fight
true.
of how much
That
they
part's
should
exactly
be able to
true.
charge the government.
I mean, an MRI costs whatever an MRI costs, but some hospitals have as many as 110 different pricing options for the exact same procedure. That's true. But it's also true.
But you can't see it because, again, and that's where I was
understand that,
getting
but hold
to, and I
on. It's
apologize
also
for not
true.
moving fast enough. But the fact is, the patient isn't the payer. What we don't see this sort of problem in the Snickers market. We don't see this problem even in the car market, which is fairly opaque. What we need is if patients have more money in their pocket, then patients will seek out better care. They'll seek out better care from somebody like Josh Umber of Atlas.
I don't disagree with that.
City.
But you can't argue with the fact that there are 600 hospitals today that could go bankrupt in the next 30 days, depending on how things go.
I can argue with that, and I can support that because hospitals are ripping off Americans every single day. Again, you should go into a hospital.
How many hospitals went bankrupt in America?
You should be able to get cheaper care at every single hospital
25
in America.
hospitals.
And instead, they charge the government more money. They're taking your kids broke and my kids broke. I'll argue every single day about that.
25 hospitals went bankrupt last year, or was it more? Hospitals go bankrupt
more should
daily.
Go.
So people in rural America, the hospitals in rural America should just go bankrupt. That's insane.
They could charge 700% more than an independent physician's office. It should be much less than an independent physician's office.
But hospitals are going bankrupt, and you're okay with that?
Yeah, you know why they're going bankrupt? Because they have so much administrative people on their side that they are running their business wrong. If you look at Keith Smith in Oklahoma, he doesn't.
All right,
he
stop.
charges patients
Okay, here's it. We're out of time.
Because
we're out of time.
he
You need to
doesn't
come
have
back.
the
Stop.
administrative support.
We're out of time, but you need to come back because I don't agree with you on a number of these points. Having done a deep dive myself, I think you're mistaken on a couple of points. But I'll have you back anytime you want.
That sounds good.
Appreciate it. And when he comes back, we got to get his camera fixed. Anthony.
Why am I going blurry?
Yeah, you were going blurry. We'll fix that next time around as well. We'll fix that and your outlook. Hey, we'll be all right. We'll be right back.